There are many things that determine a person's health. Most people recognize lifestyle and personal choices as one, but others include genetics, the social and physical environment, in addition to policies which can all vary in influence. Starting with genes, certain diseases may run in families, posing a greater risk for contracting the disease later in life. This can be a result of genetic mutations that can be passed on biologically from parent to child. As for the natural environment, social factors to consider include high exposure to violence that discourage outdoor activities where they can engage in physical activity. In terms of one's physical environment, lack of transportation, for example, can affect the likelihood of getting a good job or education, or even reaching a health clinic, while also requiring a lot of time that could otherwise be used for health-promoting activities. Policies may also influence health in the way that resources are unevenly distributed across communities. We could look at nearly any area where stark inequalities are present, such as employment, wealth accumulation, college completion, segregation, or the ease of obtaining citizenship upon immigration. And we would find that public policies have played a large role in creating and maintaining those inequalities.
While this is true, people need to be held more accountable for their health, starting with their lifestyle and personal choices. Diseases such as obesity and diabetes are largely impacted by a person's given level of nutrition and physical activity. Other risk-related behaviors that can be controlled include smoking and sexual activity. This can easily prevent one's chances of getting asthma, cancer, or HIV/AIDS in the future. On a separate note, the United States has a much bigger problem at hand because there are millions of people who are uninsured and lack access to health services. This country ranks among the highest in healthcare spending, but we generally have poorer health outcomes. Healthcare providers may not accept uninsured or Medicaid recipients, and even among those who are insured through government or private plans, there are often barriers involving insurance coverage and compliance of provider to offer services.
Health services and personal choices are not the only determinants of health. For example, tobacco and alcohol are heavily marketed in low-income communities. Due to social pressures, this makes it very difficult for individuals to not engage in smoking and other negative health behaviors. As for changing one's diet to improve the prognosis of underlying health conditions, sometimes it's not that simple. Many low-income neighborhoods are located in food deserts and lack even a single grocery store. Therefore, people may not have healthy options available to them.
Aside from diet and risk-related behavior, physical activity also plays a great role in reducing negative health outcomes. Another point to be made about personal choices is that people give in too easily to social pressures. This applies to situations with bullying, violence, substance use, social media, and personal technology use.
As mentioned earlier, violence-related exposures within a community discourage engaging in physical activity outdoors. Violence-related exposures within a community discourage engaging in physical activity outdoors. This would otherwise result in serious threat of injury or death. Moreover, there is also a psychosocial stress component to be considered, which in itself can lead to more cases of chronic illness. This is also supported by the relatively new field of epigenetics, which studies the influence of environmental factors like chemicals and stress.